Hi there, it's Dr. Heath McAllister again, and I wanted to talk about the potential benefits of receiving an exosome treatment. There's been a lot of research on this. There's lots of different studies, big interest in how these can be used for various different human ailments. So, overall, there are three overarching benefits that we can observe from an exosome treatment. The first is they tend to exert a very anti-inflammatory effect. We know that inflammation is part of the disease process of almost every condition that we know of. Everything autoimmune disease to the common cold. I mean, inflammation really drives a lot of the human problems that we experience. So, anti-inflammatory, everybody really benefits from an anti-inflammatory application. The other thing they do is they tend to modulate the immune system. So that means if the immune system is overactive, it tends to bring it back in a better balance. So conditions like autoimmunity or conditions where there seem to be an autoimmune component, like even MS and Parkinson's, but the Hashimoto's and rheumatoid arthritis is a whole suite of autoimmune diseases that potentially could benefit from having the immune system more finely tuned. The other thing that the exosomes do is they induce tissue regeneration. So whenever you have tissue breakdown, you need to be able to repair those tissues. And if you can't repair those tissues, you go into a degenerative state. This is most often seen when people have things, say, like arthritis, osteoarthritis, which is, you've worn away the cartilage in your joint or your ligaments or tendons are weaker. So that degeneration, in order to stimulate those tissues to heal themselves, exosomes are a huge potential boon to that. Whereas someone else, the only other option that someone might have would be, say, surgery. So in some cases, you might need surgery. In other cases, you might be able to repair the tissue with an exosome treatment. So there are incredible benefits to the exosome. So think about things like arthritis, chronic pain syndromes, wound healing, degenerative brain diseases. Exosomes are tiny. They can percolate through the blood-brain barrier and actually affect neuronal tissues. So therefore, traumatic brain injury, stroke, and then specific organ support that they tend to provide: heart disease, kidney disease, liver disease. Those are some really important things. Your brain, your heart, your kidney, your liver. So exosomes have this incredible ability to stimulate self-healing in the body. And they do it with low reactivity. They do it with very, essentially no side effects and all these potential benefits. So this really is the new revelation of the modern age.